My name is Kathryn Nichol, and I am currently a policy advisor at the Ministry of Labour on secondment from the Public Services Health and Safety Association. Today I was discussing a research study, and what we are looking at is Joint Health and Safety Committee functioning and impact in acute care hospitals in the province of Ontario. The main issue stemmed from the results of the Campbell report, which is a report that was done after SARS hit Ontario in 2003. So the report was released in December of 2006, and essentially what the report said was that Joint Health and Safety Committees in Ontario hospitals were not functioning effectively and were sidelined during SARS. So what we're interested in as a group is what's going on in Joint Health and Safety Committees in Ontario hospitals. Why are they not functioning effectively? And most importantly, how can we help them to improve their functioning and enhance their functioning? As you know, Joint Health and Safety Committees are required in all workplaces in Ontario with 20 or more workers, and they have been required since 1978. But in hospitals, there's a couple of challenges or barriers, possibly a little bit different than other sectors. The first is that Joint Health and Safety Committees work separately from infection prevention and control committees or practitioners. And that was definitely something that was highlighted in the Campbell report as being a problem, essentially that the two worked as silos and didn't work together. It's a two-part study. The first part was a cross-sectional survey of Joint Health and Safety Committee co-chairs in Ontario hospitals. And what we did is we mailed out the survey to the hospitals and actually received a 58% response rate, which is a very high response rate for a mail-out survey. We sent it to the Chief Executive Officer. We did that for a couple of reasons. One was because we wanted to keep the Chief Executive Officer in the loop and informed about the study. The second reason was because there is no listing of Joint Health and Safety co-chairs available. So we needed to determine a way that we could access those people within the hospital, and hoped that the way to do that would be through the office of the CEO. And with the response rate at 58%, obviously using that CEO as that point of entry was successful. So one of the things that we asked in phase one of the research was how well do you interact as a Joint Health and Safety Committee with the infection control practitioner or committee? And it was approximately 60% indicated that they had excellent interaction. And we think that this is due to the changes that happened post-SARS and the enhanced attention that was paid to the healthcare sector that led to this good interaction. Phase two of the research takes a step further. Phase one essentially looked at baseline information about roles and resources of Joint Health and Safety Committees in Ontario hospitals. Phase two, we wanted to really get at effectiveness and impact. What impact do Joint Health and Safety Committees have on health and safety, and how can we enhance the effectiveness of committees in the healthcare sector? So what we designed was a qualitative study that looked at workers and management in 3 hospitals, one small, one medium, and one large. And then we also wanted to look at external stakeholders and what their opinions were around gold standard Joint Health and Safety Committees and how to assess performance. Campbell identified Joint Health and Safety Committees as not functioning effectively. And the studies that we designed were directly as a result of this. And even today, with the occupational health and safety review that was done by Tony Dean, and the report that was submitted to the Minister of Labour in December identifies that Joint Health and Safety Committees are still an area of interest, are still seen as a key component of the internal responsibility system, the spirit behind the occupational health and safety legislation in the province, and still need to be looked at as a leading indicator of health and safety performance in workplaces. So one of the worries with research is that over time, the appetite may change. I think that with this research into Joint Health and Safety Committees, that the appetite is still high for this kind of work. It's still important work, and it still will impact occupational health and safety performance in the future. So I think it's something that we continue to look at.